Imagine a sudden, intense pain that makes even the lightest touch unbearable, often striking without warning. This kind of overwhelming discomfort, especially in your joints, is exactly what emergency clinics are prepared to address swiftly and effectively. They understand that when you arrive with such symptoms, rapid relief is your top priority. Emergency clinics primarily focus on to immediate goals when you present with a gout flare-up, confirming the diagnosis and providing rapid pain and inflammation relief. They use a combination of physical examination, patient history, and sometimes laboratory tests to distinguish gout from other conditions that might mimic its symptoms, such as an infection, which requires a different treatment approach. The core reason emergency clinics prioritize quick action is to alleviate the severe pain and inflammation characteristic of a gout attack. Left untreated, the intense pain can be debilitating, and prolonged inflammation can potentially damage the affected joint. Their approach centers on calming the storm as quickly as possible to restore comfort and prevent further complications. When you visit an emergency clinic for a suspected gout flare-up, you can expect a careful evaluation. Doctors will typically inquire about your symptoms, medical history, and any previous gout attacks. They might perform a physical examination of the affected joint, looking for swelling, redness, and tenderness. Sometimes, if the diagnosis isn't clear, they may even draw fluid from the joint to test for uric acid crystals and rule out infection, which is a critical step. Treatment for an acute gout attack in an emergency setting often involves powerful anti-inflammatory medications. These can include non-steroidal anti-inflammatory drugs, or NSAIDs, such as indomethacin, colchicine, or oral corticosteroids. In some cases, if oral medications are not suitable or effective, an injection of corticosteroids directly into the affected joint can provide very fast relief. They will also educate you on ways to manage your pain and recommend follow-up with a primary care doctor or a rheumatologist. A key insight is that while an emergency clinic excels at acute symptom management, its role is not long-term gout prevention. They are masters of crisis intervention. Their aim is to get you out of immediate distress and back to your life with manageable pain, ensuring that potentially dangerous conditions are ruled out. This focused approach on rapid relief means you receive targeted care when you need it most, providing a crucial bridge until you can consult with your regular healthcare provider for ongoing management.